So we're going to do some prone work here, and again, this is for a cervical, thoracic patient. We're going to have a pillow here just to decrease the amount of low back arching. We have our face cushion. Remember, this is quite tall. You do not want people having to extend their neck, so whenever you have them lay down on their stomach, just remember that this is going to need to tilt down a little bit. It's adjustable so you can fine tune it, but that's what we're going to start with. So Luke, if you can come around here, lay down on your stomach with your face right at that end. Good, and I'm just trying to get that, yeah, that pillow fell in a pretty good spot. People are not sure what to do with their arms. I'm going to have you kind of roll up and put that arm there, and then tuck it right there. Good. So from this posture, we're going to be working on scapular retraction. Of course, you know, you can do soft tissue massage, but keep in mind, we do not do massage here, we do stretching. And to facilitate that stretch, we do use massage techniques, but it's all about getting something moving better, unless it's that rare case where we're just improving circulation. So we're going to be doing massage techniques through here. We can try to get the shoulder blade back by doing shoulder blade stretches. We're doing a little bit of a chin tuck. Go ahead and relax there, Luke. If you are going to do any low-level laser, we're going to be doing that in such a way that we're facilitating some opening here. So we're going to be opening that, doing some low-level laser there, you know, as long as the person can tolerate that. But everything has a purpose. You could do some deep pressure inhibition through there to find those knots. There, I've got one there. Take a big breath and then out, and again. Good. Even if you wanted to facilitate some shoulder blade retractions, we could bring the muscle stimulator in here and do that between the shoulder blades and have a person resting in this position but doing shoulder blade squeezes. Go ahead and squeeze your shoulder blades there. There we go. And then back down, and then up again, and back down. Perfect. Now we're going to move right from there into an exercise that's easy to teach here, and that is the eye position. And I was not courteous to Luke. I should have had an ankle support here. Luke, I'm going to put this underneath your feet. This just takes a little bit of pressure off the spine, and we're going to go right into an exercise here. And this is what you can do when you combine exercise with treatment, especially if you need to go out and check on somebody. You know, I would never say, Luke, I got another person here, I'm going to go check on them, I'm going to be back. I would say, okay, we've got you mobile here, now we want to do a little exercise. Go, and it's true, it's just a more positive way to frame it. I'm going to have you keep your arms straight, squeeze your shoulder blades up and back like that. Good, hold that position there for about 5 seconds, 5 to 10 seconds, and then go back down. So that's going to be the first one that you're doing. And then we're going to go into a W position like this with both arms. Excellent. And then from there, I want you coming up and back like that, holding that posture, and then back down. I want you to do 10 of those. And if a person's really high level, I would be going all the way up here and all the way up here, and then doing the Y position. I like this because most people cannot get back to parallel with the floor, but this table allows you to do that. If you try to do this on a gym table or on the ground, most people are working at end range. All they're doing is irritating their joints. So do the Ys very sparingly and do them in this posture. It'll work a lot better. Luke, I'm going to have you lift those thumbs up towards the ceiling and squeeze your shoulder blades down and back like that, and then like that, and then down and back. Try to keep your elbows straight. And you know, this is something to think about. If you have a shoulder patient and you want to work on this type of elevation motion, this is a lot more difficult than having them stand and do scaption. So the evolution of the shoulder protocol is to do standing stuff before you do lying down. This is the rare case, at least when it comes to the shoulder, that the lying down exercise is actually the most difficult. So just be aware of that, and be aware that most of the things that we do, there's a fine line between therapeutic exercise and manual therapy, because you can see I'm doing manual therapy with him as he's exercising, and we should always be incorporating manual therapy into Therex to the point that it should be difficult to even label what we did, and that's okay.